Hello, this is Dr. Sungchul Park, Director of Yubei Plastic Surgery. Today, I'll discuss chest wall depression after implant removal. Many patients choose to remove implants due to complications, aging, or discomfort during exercise. Common concerns include whether the chest will look deformed or saggy after removal. This video will address those worries. When implants are inserted, the central area protrudes the most, causing compression and tissue atrophy over time. The breast consists of skin, fat, glandular tissue, muscle, and bone. Among these, glandular, fat, and muscle tissue contribute most to breast volume. The upper breast has less glandular tissue and more muscle, while the lower breast contains more glandular and fat tissue. Since glandular tissue is firm, it resists shrinkage, but muscle tissue is soft and elastic, making it more susceptible to implant compression and atrophy. After implant removal, muscle atrophy causes upper chest depression, but as the sagging lower breast gains elasticity, it lifts upward, restoring volume. Proper pectoralis muscle repositioning is crucial for recovery, and consistent muscle exercises after surgery can help improve upper chest contour. Thank you for watching.